Start by putting on your PPE or your personal protective equipment. It is recommended to wear gloves, a mask, and protective glasses. These will help protect you from harmful bacteria and possible contaminants that aerosolize during the procedure. Gross calculus deposits are removed using calculus forceps or dental extraction forceps. Always avoid damaging the gingiva. Basically, what I'm doing is applying slight pressure with a little bit of a turn to help break the tartar. Depending on your equipment, make sure to change your settings for speed and water level. Always make sure water is coming from the handpiece before beginning to scale. This will cool down the handpiece and the tooth to decrease the chance of damaging the enamel. Lightly hold the ultrasonic scaler in your dominant hand between your thumb and index finger like a pencil. The scaler tip should never be directed at a 90-degree angle towards the tooth surface because the tip will cause damage to the enamel. Correct angle of the tip should be held at an angle of 0 to 15 degrees from the long axis of the tooth. Keep scaling no longer than 10 seconds on a single tooth to decrease the chance of damaging the enamel from heat and friction. When scaling, it's important to remember to scale the buccal and lingual sides of the tooth. Gently pull the tongue to the side of the mouth to help visualize. For subgingival cleaning, a curette can be used. A curette has a sharp working side edge and a rounded tip. Insert gently into the pocket until resistance is felt and tilt the curette away from the tooth to engage the sharp edge against the root surface. Then pull firmly out of the pocket. Checking for pockets should be done on every side of the tooth. Keep the side of the tip of the probe in contact with the tooth using a light touch. The probe is walked around the circumference of the tooth with short up and down strokes every few millimeters. Normal depth in a dog is 0 to 3 and in cat 0 to 1. Anything greater is a pocket. For places hard to reach with your ultrasonic scaler, you can use the hand scaler to remove plaque and tartar. Polishing is necessary to smooth the surfaces that have been microscopically scratched during the scaling procedure and to remove any existing stains that were not removed by the scaler. Make sure to use care while polishing to not damage the tooth. This means using adequate prophy paste and a low RPM. Only polish for 1 to 3 seconds on each tooth surface, then rinse the prophy polish away. Charting is strongly recommended for every dental procedure. This documents the extent of disease and can be used for comparison in the future. After the procedure is done, this chart should be scanned and placed into the patient's file.